were talking, they were taking videos and pictures of me, we were laughing, everything is giddy and kiki and everything. And then my surgeon comes in, and my surgeon was like, he's a dreamboat, you know, like he's such a dreamboat, he's such a nice guy. He's so thorough and just very, very, I really believe that he loves what he does, you know, putting them at ease, which they did. And so my mother, you know, she's very religious, and so she was like, oh, please, look, can I just pray over you? And he was like, really? He was like, okay, that's fine. And so we all bowed our heads and prayed, prayed for the surgeon and his hands to be steady and all that. And so he was very gracious about it. I don't know what religion he is, but he was very gracious about it. And, you know, he really put them at ease. And my mother got all kind of choked up. Then my anesthesiologist came in. So I'd never met her, but you're going to do great. What I'm going to do is I'm going to give you a little bitty cocktail in your IV. Your IV is already set up. I'm going to give you a cocktail, and it's just going to chill you out. You're just going to take all the nerves away, and it's going to, you know, just going to get you prepared and kind of take your nerves away and get you ready for surgery. I was like, okay, yeah, like it's going to be a little cocktail. You're going to be feeling great. I was like, oh, yeah, I'm all for that. Like, give me that cocktail. So they gave me the cocktail, and she was like, as soon as we give you, we're about to push you out, say goodbye and everything. And so I said goodbye to my family, gave them all kisses and everything, and so they left. So she gives me the cocktail. I immediately feel woozy. I feel so good. It's like, I thought I was on 10 and happy about having the surgery before. I felt like I was in the best club and they were giving the best margaritas or the best Manhattans that I'd ever tasted. And I was the most popular girl in the place. And I wasn't on like a little gurney. I was just like ready. I was high-fiving people. I was ready to go. They're wheeling me into the surgery room. And there's about 5 or 6 people all around the room getting things prepared. I'm on the bed where I'm going to have my surgery. And my anesthesiologist and another girl is like wheeling me in there. While they're wheeling me in the room, they're speaking to each other. They're like, oh, hey, Susie, girl, how was lunch yesterday? They're like making small talk each other because they're coworkers. And see, I haven't thought about this in a long time, so I forget exactly what I say. But one of the girls that's wheeling me in says to somebody, oh yeah, did you see something, something, something? I'm feeling so good on my little drug or whatever that they put in my IV that I chime into the conversation, me, the patient that's about to have the surgery. I'm chiming into the conversation like I know what they're really, like what's really going on. I'm like, girl, yeah. Even me thinking about it. I said, I forget what I say, but I'm like, girl, yeah. And I'm sitting up here about to have this surgery, and I don't really know why I thought that. Like, it's something so crazy. I used to remember exactly what I said, but I can't remember. But I remember saying that. And they were like, right? And I was like, no, girl, yeah. So over my face, and they're like, okay, we're just giving you some oxygen. We want you to breathe in really deeply and everything. It's just going to make you, you know, feel really relaxed. I'm like, okay, cool. And so I breathe in. They tell me to count backwards from 10 to 1. And I get to like 9 and I'm out. Next thing I remember, I am in the recovery room and I have the CPAP thing on me that's breathing for me. But when I woke up, I had a nurse right by me, and I guess as soon as she saw my eyes flutter, she explained to me, okay, Dina, you're out of the surgery. You did great. You know, she was very reassuring. She was like, you have the breathing machine on. Just, you know, don't struggle. Just breathe with it. It's just making sure that your lungs are clear. Just let it breathe deeply, and we'll take it off in a minute. So if you've ever had a CPAP, or I think it's called a CPAP, whatever it's called, it can be overwhelming because it takes your own ability away from breathing on your own. Like, you don't get to like hold your breath or breathe at a time when you want to. It is pulling air in and pushing it out. And it's not a tube down your throat, it's just a machine that's hooked onto your head. And it's very, very, very strong. And, you know, as soon as I felt that, and I felt that I was breathing, but I wasn't in control of my breathing, is the best way I can explain it. I did get like a tinge bit nervous. But as soon as I realized, okay, don't panic, don't squirm, don't go crazy, and I just concentrated so heavily on this machine and breathing with it, like letting it.
Hi YouTube. Okay, so I'm gonna finish up the video that I was talking about. I had to go to sleep. Okay, so my surgery day situation. So where I stopped off was, I'm feeling good. Everything is feeling okay. I feel great. You can hardly tell I've had surgery, although I'm a little bit woozy. So I go from the recovery room to my own room. And as soon as I get to my own private room, you know, my family is with me. They help me set up. By this time, I have not had any ice chips, any water, anything in my throat. My voice is really groggy, like I'm talking like this. You know, you can hardly hear me because I'm really hoarse because of the CPAP thing, and because of, you know, having the tube down your throat when you're having the surgery. Like, your voice is really scratchy. So my throat was really scratchy, and, you know, I was dying of thirst. I wanted some ice chips, but they don't let you have anything until you have your barium test. And then they give me this little bitty 1 ounce cup, and it's not even halfway or a third of the way full. And they say, okay, you're going to drink this. You may not be able to drink it all. Just try to drink as much as you can, and then hold it in your mouth. And when we tell you to swallow, swallow. And we're going to take a picture or video of you swallowing, just to make sure that you don't have any leaks in your sleeve. Like, you do that immediately. Like, almost like, it's probably like 2 hours or so after I had my surgery. Before you can ingest anything, you have to have the test. So the amount that I can swallow, because in my all of the research that I did, everybody complained about the taste of this barium drink that you have to drink, and it's so, you know, you're gonna want to gag and you're gonna throw up. So that's what I was preparing for, and that's not what happened. The issue that I had was really actually with the amount that I can drink. You know, so they give you this little bit. They're like, okay, just drink as much as you can, put it in your mouth, and then when we tell you to swallow, swallow. So I put it in my mouth. When they tell me to swallow, I swallow. And when I swallow, it is like a jagged rock going down my esophagus into my sleeve. Like, I can feel every point where the liquid is going. It's the consistency of really thin cough syrup, you know, and it's clear. So it's not very thick, and it wasn't a lot. I just had like not even a half of a mouthful, and I could just feel it. So the best way I describe it to people is, when you have the vertical sleeve, they're going to make your stomach from a football shape, like this, to like the size of a banana, like this. And then so your stomach is like gonna be like that, you know, that hole. Okay, let's say how big. That's a good size sleeve. Well, when you're hours out of having the surgery, you know, you have swelling. Your normal sleeve, which is going to end up being like this after a few months, is actually swollen to this. See that little piece of like in there? Yeah. So if you imagine, okay, yeah, I can probably eat like very well chewed chicken and it'll go through there no problem. And when it's swollen and like this, it's like, okay, even when I drink water or like try to swallow my saliva, it is difficult, you know? So, and then God bless him, I think my surgeon made my sleeve a little bit tighter than normal. I was a big girl, close to 400 pounds. I had a lot of weight to lose. I still have a lot of weight to lose, and so it's not like a pain, but it is like a pain. It panicked me a little bit, and so I immediately felt like I was going to throw up, and then I kind of was like, I think I'm going to throw up, and they were like, don't throw up. Like, whatever you do, don't throw up. Get her down. Like, let her sit back in the wheelchair or whatever. Just calm yourself, Miss Lewis. Like, just breathe, you know, don't throw up. You know, we're going to have to take one more picture, but just gather yourself or whatever. So I sat down and I was like, oh my God, like, you know, because I wasn't mentally prepared for, I'm not going to be able to drink. I can't drink water. It's going to hurt. You know, no one told you about it hurting when you ate, and I'm never going to be able to eat again, and how I'm going to be able to swallow saliva, and I can't take pills. It's like, oh my God, you know, what did I do to myself? So I was kind of panicking, but that's how I was feeling on the inside. On the outside, I just was like, told me to swallow. I swallowed, and I still had that sensation. So I go back to my room after the test is done, and they tell me the results. Everything's fine, no leaks. So now you can have ice chips. Of course, I still sound like Kermit the, not Kermit the Frog, but I have a frog in my throat, and I'm really scratchy and everything. And I was dying for ice chips or water just to quench the fire in my throat. And now not so much. Now I don't want to say I was afraid of drinking water, but I was concerned because now I'm like, oh my God, it's going to hurt. Like, you know, I'm in pain. I didn't understand what this was. So when I talked to the nurse when I was back in my room,
surgery,
she did explain to me, okay, you have a lot of swelling. You know, your
not
sleeve
really in no
is pretty
pain.
tight. You have a lot of restriction. And so that's just
5
the sensation
incisions.
of it going down your esophagus, but you just have a lot of swelling. That will go away.
What you call that?
So here's your ice chips. And so I was
That
like,
thing.
I couldn't have that excitement
Laying
about
up,
having ice chips anymore because
and
I was
I finally got
really
to
afraid. So what I would do is I would take the ice chips in my mouth and I would like push it around, just wet my mouth, and then I would spit it out. I just was
every
too
10 or
afraid to
15
swallow.
minutes.
And
I had my surgery.
I would even, like, I was doing that for
today
so
at
long
10:30.
and then they even limit your ice chips. They're like, okay, you can only have like 2 spoonfuls of ice chips an hour or something like that. And so since my boyfriend spent the night with me in the hospital, he was like, you've already had 2 spoonfuls. You know, you're gonna mess up your stomach. It was like, calm down. I'm not really drinking it. You know what I mean? Like, he was very overprotective, and so I was like chewing it, and I even was like gargling, trying to get it as far down my throat as I possibly can without swallowing, and then I would spit it out.
I had to do
it did help.
a bariatric swallow test.
That was basically it. That was my night.
And what they had me
take
swallow,
a few swallows.
number one, it didn't taste good, and then number two,
acclimated to that feeling.
Sleeve is still swollen and tight, so it stayed in my esophagus for a long time before it went down to my stomach, and I felt like I was going to throw it back up. But I'm doing the ice chips really well, and I plan on walking later tonight, probably like in an hour, and then I'm going to go ahead and go to sleep. But the best thing is I feel like all of my gas is passed. I don't feel gas pains anymore. So that's awesome. And even though my hair looks good like this, if I pick my head up off this pillow, it'll be so flat in the back.
I wasn't prepared for this. And so kind of went on for the rest of the night. My boyfriend spent the night. My mother and my sister left. And then the next morning, I'm ready to be discharged, like early, like 8 o'clock. But I hadn't had a breakfast. And so they were like, you know, they want you to have breakfast and kind of get prepared. And I really wanted to have my first real food, or not food, but, you know, the liquid that you can eat in the hospital. Because I was like, if anything go wrong, y'all, like, come and see about me. You know, I need to know what to do, like, tell me the steps and everything. So, and then water.
Here's my very first
chips. And then they gave me a pack of those 1 ounce little baby cups. I had like 20
yesterday at 10:30 in the morning.
And then they explained to me what you do is whatever you're gonna eat, put it in that 1 ounce cup first, and then eat it from the cup.
And I have not had anything but a few ice chips.
So I was like, okay, fine.
And now,
so of course, like, you gotta, it's a little cup, and you gotta dip it in your
1 ounce
your tea or dip it in your broth or whatever, and then it's all over your hands and everything. And I was like, okay, this is a spoon. I know how to eat from a spoon.
Not very warm.
So I ended up eating like 2 spoonfuls of the coolly lukewarm broth, and then
so I will come back and show you how much
the
I was
tea
actually
and
able
then
to
the Jello. So the Jello, of course, was
tolerate.
sugar-free and all that stuff or whatever, but you know, that's what I was looking forward to. And I took the tiniest, a half of a teaspoon of the Jello, and I put it in my mouth and I swished it around so that it's now liquid. It's not like real Jello like that you can chew. And I swallowed it, and the pain came. It was like, okay, Jello is too thick. That's weeks away. I can't do that right now. And then that was it. That's all I ate. I wasn't looking forward to, like, I wasn't like starving or whatever. Like, I didn't feel hunger at all for the first like month that I had my food.
Day after surgery.
Your hunger, that hunger feeling truly does go away. So it wasn't that I wanted to eat because I was hungry or whatever, or I had mental hunger or anything like that. I just wanted to test my sleeve and see what I could or couldn't do and how I was going to feel, especially from having that barium test the day before. So my surgery situation was kind of ideal. I didn't have any pain. I walked pretty early on. The only thing was I felt a little bit wooziness walking too soon after having the surgery. Of course, your voice is really dry, so I sound like a man for the first day after. And then the barium test, just being surprised about having that sensation of feeling liquids go down and kind of feeling like a little pain. But other than that, my surgery, you know, my hospital stay was pretty awesome. I have really good friends and family, you know, to support me, and they still support me to this day. And we're all kind of like on a health journey, and everyone has like kind of gotten better. And I've had a chance to kind of be an inspiration to them as well. So I hope I'm an inspiration to you if you're going into surgery or if you just came out of surgery. You know, let me know how your hospital stay was or what you anticipate going through a year in a hospital. Make sure you give this video a thumbs up. Subscribe to my channel. Let's inspire each other. And thanks for watching.